My name's Katie Castagna. I'm President and CEO for United Way, Monterey County, and I'm sitting here today with Dan Baldwin, who's the President and CEO for the Community Foundation for Monterey County. We're here to talk about Impact Monterey County, a multi-sector collaborative that engaged Monterey County residents of all ages in a dialogue about our collective future. We want to talk a little bit about the process today. We went out and gathered data, including primary survey data from thousands of individuals living here in Monterey County. We had community conversations, and over the past few years involved 7,000 plus people in a very intensive dialogue about the future aspirations we have for Monterey County.
The goal was really to hear from people. What are their hopes? What are their aspirations? How would they like to see their community improved? We in the funding community and in the nonprofit sector, for as committed we are to all this work, we know that we sometimes maybe work in a bit of a bubble, and so it was very important to actually turn that information around and to hear from the residents of Monterey County to find out what was important to them. The main categories: education, economic self-sufficiency, and health really emerged. And with Impact Monterey County, what this flows into is a process called collective impact. And it's collective impact means that rather than fund particular projects or organizations just based solely on their discrete work, if that work is organized around a known set of needs that multiple organizations are working together on, then those resources will be better utilized and they will get very much to the heart of the matter. What was really, really wonderful about Impact Monterey County was that we learned, and I guess reinforced what we already knew, but learned that the people of Monterey County have very high aspirations. And so now it's our job to assist them in achieving those.
So it truly was special that we had this focus on aspirations. So often we start from a place of deficit or need when we engage the community. And what we wanted to do with Impact Monterey County was articulate a vision for the county for what people want to live in, a vision that people will really go to bat for. Our researchers couldn't find another community assessment that took this approach. The results from Impact Monterey County far exceed that which was required to be statistically significant.
So this is a methodology now that is being used all across the country. There are also some collective impact initiatives already underway in Monterey County. Part of this will be then to rally those together to make sure that we're all working in alignment. The vision, values, and priorities that have emerged will get shared, and it'll help unite us in our work. Monterey County has many, many diverse communities, both economically, geographically, and so it's a real challenge to try and create a process that merges these, but that's part of the challenge. And Impact Monterey County brings clarity to this work, and I think it will really have a big impact.
So we all own this work. United Way initiated Impact Monterey County, but it really quickly grew into a collaborative community effort, and that was the intent all along. The foundational work, the concept, the initial goals, and the scope were provided and driven by United Way. But we invited leaders to participate from across multiple sectors, and we made space for community ownership at all levels. Over 120 volunteers representing 65 partners from government, nonprofit, business, and faith communities were part of making Impact Monterey County come to life. We're building a community where we all own the problem as well as the solution. The next part of this program you're about to see is a presentation from local community leaders of the data, the research, and all the analysis that went into Impact Monterey County. And then we have a panel of experts providing discussion and really conversation about the findings and what they mean to us.
Thank you, Katie. Is my mic on? Oh, yes, it is. All right. So great to see everyone here today. So it's my job to share with you what our task was, how we accomplished that task, and again reiterate why you should have confidence in our findings, and a little bit about the priorities that rose to the top. So, Impact Monterey County used a three-pronged approach to zero in on community aspirations. The first part of that approach was conducting a review of existing secondary data sources. The second was implementing two surveys, a youth survey and an adult survey. And in the adult survey, we did take particular care to look at aging populations and the disabled. The third piece of data that was used in this process was community conversations. And they were small kitchen table style conversations that helped us to better understand the day-to-day real life experiences of folks who live in Monterey County. We then went through a process of analyzing that data and zeroing in on the commonalities across the diverse community. What unites us from Pajaro to San Ardo, from old to young, from those who are struggling to make ends meet to those who are living more comfortably? What we found was that we're more alike than we might think, and that our shared community vision, values, and priorities will lead us to wonderful solutions. Now I'm going to talk a bit more about each assessment method, starting with the secondary data. So as you will see from these sources, we did not start from scratch. On the screen is a sample of local, state, and federal data sets and reports that were referenced by our researchers, CSUMB's Institute for Community Collaborative Studies. And I will refer to them hence on as the researchers, so I don't have to say CSUMB's Institute for Community Collaborative Studies. After reviewing the secondary data, we narrowed our focus down to three domains: education, economic self-sufficiency, and health. We selected those areas because they appeared to be the most foundational, most likely to get at root causes and lead to lasting change. Here's some more of the secondary data that was looked at. As Katie mentioned, the researchers also conducted a literature review of assessments to help us figure out how to design our own aspirational assessment. And what they found was that we were attempting to do something very unique. Large-scale assessments usually focused on needs or experience, and the researchers couldn't find another large-scale assessment that asked people about their aspirations. So what we did here was incredibly special for that reason. And instead of coming from a place of deficit, we asked people about their hopes, their dreams, their aspirations. And we wanted to make sure that this data was seen as a flashlight, shining a light on opportunities for improvements and existing bright spots. The data does not analyze or evaluate one system or program. So, starting from the findings related to this secondary research, Impact Monterey County's data team developed an 82-question adult survey. It had multiple choices and open-ended questions. Here's a list of the incredible people who participated in the data team. And you'll see that they come from a wide variety of organizations and backgrounds. The survey was administered between July 1st and October 31st, 2014. In that short time, you'll see that 4,220, my pointer's not working, but that's okay, 4,220 valid responses were collected. A response was considered valid if a Monterey County zip code was provided. There were only 186 non-valid responses to the survey. On this slide, you'll also see the demographic distribution of adult survey recipients. in a few areas there was underrepresentation or overrepresentation compared to our population in the county. And what the researchers did was weighted in post-stratification and right-sized those results. Since zip code was the only required question in our survey, it's the only variable against which any kind of post-stratification weight was applied. I don't know if I'm speaking gibberish to some of you, but I know others of you are really interested in this type of information. The survey was available in both English and Spanish, and it could be completed online or on paper. We used what's called a convenience sampling method, which means that anyone who was interested could give input. And because of that, we wanted to have a bold participation goal of 1 to 2% of the county population participating in this survey. We achieved that goal with more than 1% of the approximate 415,000 adult population completing the survey. This gives us an extremely high confidence interval for the data. So next, in terms of looking at adult survey age, we were pleased to find that the people taking the survey were willing to share quite a bit about themselves. On this slide, you see the age breakdown of respondents, and as you'll look, you'll see that the respondents closely mirrored the actual distribution of age in our county. In terms of household income, again, we had pretty close representation for the county-wide population figures. And the high number of valid responses is something that is really unusual in these types of surveys. A lot of times people don't want to give their economic or their household data income information. In terms of ethnicity, looking at the next two slides, we'll look at ethnicity and gender. You'll see that the percentage of people reporting their ethnicity as Hispanic or Latino was just under 40%, while our actual population group is closer to 55%. So this is an area of improvement for future surveys. In terms of gender, as is typical with most surveys, women responded at a much higher rate than males. I'll conclude my review of the adult survey demographics with this highlight. When you look at the length of residence in Monterey County, you'll see that 54% have lived in our county for more than 20 years, and nearly 23% have lived in our county for 10 to 20 years. The aspirations uncovered by Impact Monterey County represent people who have and are making their lives here. Their voices deserve our attention. So turning now to the youth survey, you'll see from this list that we also had a great team leading that effort. The survey was a scaled down version of the adult survey developed by the youth engagement team in concert with the data team. Like the adult survey, the youth survey was available online and in a paper version. The survey instruments included 37 multiple choice and open-ended questions. Thanks to an amazingly strong partnership with the Monterey County Office of Education and our local schools, the survey was administered to 11th graders in the county's public schools in March of 2015, and we had almost 60% of the 11th graders participate in this survey, which is amazing. Noise Research and Consulting served as the lead researcher and analysis partner for this effort. There were 2,831 valid responses in the youth survey, and again, zip code was the only required field. So, when we look at the age and gender, 92% of the students who participated in the survey were between the ages of 16 and 17 years old. And of the students those students who took the survey are actually the class of 2016, now only 6 or 7 months away from completing their high school careers. As you'll see here, there's an even split, almost even split between the males and the females. So I guess you got to get the boys captive in order to get them to respond to a survey. So in terms of length of residence in Monterey County, 78% of the students who completed the youth survey have lived in Monterey County for more than 10 years. Impact Monterey County will be making all of this data available from the adult surveys and the youth surveys in a searchable format on the website. Some of it is already searchable now on the website, and that's going to be a great resource for all of us who need to write grants, proposals, use it for various purposes. It's a wonderful resource to have. Turning to Monterey County Impact's third set of data, it was generated through the community conversations, which again I said was a kitchen-style type dialogue. There's small groups, about 8 to 10 folks would get together to have a conversation. Volunteers were trained by Communities Organizing for Relational Power and Action, better known as COPA, to listen to conversation participants who shared their aspirations, their stories about their experiences. We heard about hopes, aspirations, and opportunities in these conversations. Like the other surveys, they were structured around 3 areas of study: education, economic self-sufficiency, and health. In the end, more than 400 people participated in 80 conversations from June through October of 2014. Conversation summaries were then explored by volunteers to identify the shared themes across our county. Noise Research and Consulting was the lead analysis partner for the community conversation data. Participants came from all over the county, as you'll see from that slide, with overrepresentation from people who lived in North County, a slight underrepresentation from people residing in Marina and Salinas. Even though it has Gilroy and Santa Cruz on there, that's just a map that was used for this process. The people came together from the areas that are listed there with the bullets. So, in terms of a demographic snapshot for the community conversations, participants had an option of providing that demographic data when they came and participated, and we asked them for similar information as to what we had in the survey. So there were 400 participants. Of those who chose to respond, 75% were women, 26% spoke Spanish as their primary language. In terms of race or ethnicity, conversation participants from the various racial and ethnic groups in Monterey County were well represented, with persons identifying as Hispanic and Latino at 55%, which mirrors our general population. 78% had lived in Monterey County for 10 or more years, and 43% of participants earned $35,000 or less, and half of those were households who had 5 or more family members. By age, the community conversation participants represented the adult population of Monterey County, with 41% of them between the ages of 24 and 49 years old, and that's compared to 48% of the population who are in that age range. Full narrative reports and copies of the PowerPoints can be found in the Impact Monterey County website. So, now that you know our work was grounded in research, a lot of people that are highly regarded in their fields were involved in the design and implementation of the instruments. A heck of a lot of community members participated, with almost 7,600 touch points, and they participated in various ways that felt appropriate to them, whether it was online, on paper, or in person. And those who participated mirrored our population in a number of ways, especially when it came to income and age. The voice of our 11th graders was loud, clear, and strong. And we made concerted efforts to reach out to special populations, the disabled, aging, and extremely impoverished. So now it's time to hear what rose to the top as priorities for them. Their community priorities are: people are economically self-sufficient with opportunities for more prosperity. People's educational achievement supports career aspirations and lifelong learning. People are mentally and physically healthy, and people are safe. So now I'd actually like to introduce Sharon Gish, who's going to serve as the moderator of our panel discussion, where we're going to delve deeper underneath each of these broad priority statements. Sharon?
Good job, thank you. Thank you, Francine, great job. That was a great job reviewing the process and who was involved. And it's a pleasure to be here today with share these priorities with all of you community leaders. The 4 statements that you see up there are succinct, they're clear, and they took us a long time to get to them. So if you think that was easy work, getting all of that information that Francine talked about into these 4 priorities, all of you know that it did take a lot of folks, a lot of people involved in that. So I'd like to invite our panelists to join me on stage, and while they're coming up here, and I will introduce them in a minute, just come on up, panelists. If there are any questions that need to be picked up, now would be the time. Raise your hand if you have a question, and one of the staff will come around and get it for you. Okay, great. So joining me on stage today, you'll see their names. Somebody has the clicker to, there we go.
Got it, thank you.
If you could bring your names up, that would be super. Here we go. Brett Harrell from the Nunes Company. He's the first one. Sitting next to him is Cynthia Holmsky. Cynthia is with California State University, Monterey Bay. Krista Hani is with the Monterey County Health Department. And then we have Alfred Diaz-Infante, and he is with CHISPA. So with that, we will get going. Just a couple things. Let's have the next slide if we could, Brett. And before we do that, I want to just orient the group. So there are these 4 priorities, and they will come up as one slide, one at each at a time. So this first one's going to be economic self-sufficiency. But what we then did with those slides is we took those, and there are some subcategories in there. So each of them will have, each bullet will talk about what success looks like in Monterey County. And you're going to see the same layout throughout the whole discussion. So it's the overarching, then the sub-priorities. Okay? And with that, we're all on the same page. Brett, if you would tell us why the community's priority as it relates to self-sufficiency.
Our first priority is that people want to be economically self-sufficient with opportunities for more prosperity. Now, really important to talk about economic self-sufficiency. Nobody aspires to be above the poverty line. They aspire to be self-sufficient. And when we talk about self-sufficiency, we talk about being able to cover your basic expenses without assistance. The self-sufficiency level is not the same as the poverty level. The federal poverty level in Monterey County for a family of 3 is $20,090 for 2015, and that increases for about $4,160 for each additional person. So for a family of 5, that's less than $30,000. I don't know how about you, but sometimes I open my cable bill and I think that's what it is. But it's certainly not enough for people in this community to live on. We know that it actually takes, for a family with a child of 3 or younger to be self-sufficient, it takes almost $67,000. 42% of our Monterey County households and 59% of households that include a child are living below the self-sufficiency standard in Monterey County. Through the impact process, it became more and more clear that we need to change our focus. We need to change the community dialogue from poverty to self-sufficiency. People don't want to just get by, they want to thrive. Achieving self-sufficiency, we need to increase income and decrease expenses, and we'll first look at income. So adults and youth who participated in the study clearly stated a need for local industry that is more diversified and offers high demand, higher wage jobs. It's not a surprise to anyone in this room that agriculture and hospitality and tourism are the 2 largest non-governmental industries in Monterey County. It may also not surprise you that 48% of the non-government jobs available to job seekers are in these 2 areas only, agriculture and hospitality. It's important to know for several reasons. Number 1, we cannot judge Monterey County against national or state averages for unemployment because of the seasonality of both of those industries. You know, we go from a low of 6.5% in a normal year to over 13% of people unemployed. Our second point is that when we asked about career goals, I'm not sure that does any better, but we'll get working here. Can you hear me? Yeah. Okay. So did all my teachers in elementary school. I can tell you that. So last year when they surveyed the 11th graders, which, as Francine told you, are now today's seniors, they told us they were very, very interested in the STEM careers: science, technology, engineering, and math. Diversifying local industry is a must to stabilize income in Monterey County and ensure our youth have local career options that allow for self-sufficiency. It's exciting that some of that local work is already underway to address the need to diversify our industries. Those include the Steinbeck Innovation Cluster, work around ag technology, and the Monterey Bay Economic Partnership are leading efforts in these areas. So I'm going to close by talking about the community aspiration that local workers and local people and local students had to increase their knowledge and improve their employability so that they're ready for those diverse and higher income jobs. Our assessment included a significant number of open-ended questions. Researchers did textual analysis on those responses. Not surprisingly, education was the #1 way people believed they could help themselves be more financially secure. People are not looking for a handout. They're willing to put in the effort to achieve their aspirations. Thank you.
Thanks, Brett, for sharing people's aspirations around being self-sufficient. And knowing that education was the #1 thing mentioned to achieving that financial security, let's turn to Cynthia, and she's going to deal with the priority around education.
Thank you, Sharon. So in the area of education, the overarching priority is that people are able to achieve an education level that supports them then achieving their aspirations for career and lifelong learning. So that's the overarching priority. And we have 7 sub-priorities under that. And they range from the earliest years in early childhood development and education for parents and caregivers, all the way to vocational training and the life stages in between. And so these sub-priorities tell us what success will look like down the line in the future. So what did people aspire to? We learned, first of all, that about 68% of adults in our community that have a high school degree or equivalent, like a GED, would like to increase their education level if they had the opportunity. So how could we as organizations in the community figure out how to give them that opportunity? And then we also asked those same adults what they aspired for their child's education, and that's what this slide is addressing. So you have the education level of the parent on the left, and you see very high responses to the question, do you want your child to achieve an education level higher than the one that you did? So collectively, about 66% of the parents said, yes, I want my child to achieve an education level higher than my own. So we see the dream of generational upward mobility coming through. So that's some of what we learned from the adults. So what did the youth have to say? This part of the survey data is so exciting to hear the voices of our high schoolers. And boy, did they have a lot to tell us. In the pie chart that is so blue, we see that 90% of our juniors in high school said they do have a plan to continue their education after high school. That's huge. That's huge. And then on the right, we see that they were asked, what's the highest level of education you would like to strive for? And you'll see a master's degree was the most common response, followed by a bachelor's degree and a doctorate. So combined, about 75% of our high school juniors said, I want to get a bachelor's degree or higher. And why? Well, Brett shed some light on that on a previous slide with those careers. Many of them are STEM careers in science, technology, engineering, and math, and they do traditionally require at least a bachelor's, in many cases an advanced degree. So this is what their aspirations are. And what did we learn about how well they're doing? Unfortunately, we learned that about 1/3 of high school students complete the requirements necessary to get into college. And the requirements include a number of things, prerequisite courses, SATs, and things like that. So there's a gap between where the students want to go and where they're being prepared to go. And we can help them with that. We absolutely can help them meet their aspirations. The other thing that we asked was, what is your biggest obstacle to achieving education after high school? And both the youth and the parents said the cost of earning an education. And yet, again, juxtaposed to that, we learned that only about 1/3 of our students are applying for the free financial aid through FAFSA. So that tells us that some of our students are leaving money on the table that could in fact help them achieve their dreams. So we have opportunities there to help close the gap. One of the sub-priorities is to make sure that high quality education is accessible to everyone throughout the county, regardless of where you live. And I wanted to share with you one of the stories that came out of one of the community conversations. And the story was told by a woman who works in property management, and she was helping a client of hers find a home. And he was a single parent, and he had 2 children. And he could afford a 3-bedroom house in a few areas, but he felt that in order to access high quality education for his children, he needed to live in an area that really priced him out of the market. And so he moved into a 1-bedroom apartment, the 3 of them, so that they could get into an area where he perceived he could get a quality education. And that's just one story, but that theme came up throughout the community conversations. This notion that I perceive that I may not be able to access quality education, and then this notion that families make all kinds of substantial sacrifices to try to keep their kids into programs that they think will give them the education that they would hope that they would get. And in contrast to that, we also saw these really wonderful bright spots. We saw positive places where kids were exceeding expectations. So for example, looking at children through a demographic lens, we saw some groups of students that were performing much higher than their demographic peers. And so that really debunks this notion that your zip code determines the quality of your education. And there's an opportunity for the data to shine light on these bright spots so that we can go in and learn more about what's going on there, that's working well for the students, and then we can share those best practices around. So that's just a flavor of some of the education data and what we heard from our community voices.
Great, thank you. And again, that reminder that all of this data is a flashlight, and it's meant to help us identify where we can work together to help reach aspirations. And so we're all in this together. And so it's definitely not a searchlight on one thing and say, that's the problem. That we can't point at a city or a school or a nonprofit or an age group. We all own it. We all own it. We all have a part of it, for example, getting our children college ready. Everybody has a piece. And with that, we'll transition now into Krista with the health department, and she's going to talk about all the priorities there in health.
Thank you, Sharon. When we were looking at the data and analyzing it, and there are a variety of themes came out from the health data. Overarching was the priority that people are mentally and physically healthy. We really heard that in all of the data analysis that we did from the community conversations and the surveys. And there were actually 3 themes that came out underneath this health priority. And they're around access to services and healthy lifestyles, which could even be subcategorized into how the built environment helps us be healthy and how we can be empowered to make healthy choices. But then also what came out in the analysis was safety. So we're going to have Alfred talk about safety and the safety community priority, but I'm going to focus today on health. And first I'll talk to you about the access to care theme and the sub-priorities there. So when it comes to that, what we really heard from people is that they know where there's access and where there isn't, where there are services and where there aren't, where they can make healthy choices and where they can't. And really that when we also looked at the health issues, we could see that the data showed us that there are health inequities in our county. And this isn't just our county, this is being seen across the nation. But I wanted to give you a quick definition or a picture in your mind of what it means for equity to be there for people to have access. And what that picture could be in your head is if you think of a racetrack, like a track and field event, and people need to have an equitable opportunity to get over to the fastest lane, so we give them a staggered start. And so that staggered start is, in a way, when you're thinking about equity and creating equitable opportunities in our community, what we can think about how we can make those opportunities more available. So when we're talking about the access to care, the sub-priority is that health and mental health services can be accessed quickly and conveniently. And this graph here is giving us a demonstration just of one of the indicators that we looked at in the secondary data. And the top part of the graph is the usual source of care, and the bottom part of the graph is the insurance. And what the question that was asked people was how often you were able to get an appointment within 2 days in the past year when you called to get an appointment for medical care. And when we look at it by the usual source of care, what you can see is that if you didn't have a regular provider's office to go to, it was very difficult for you to get an appointment within 2 days. So there's some inequity there. But even when you were looking at it by the types of insurance, whether you were uninsured or had some type of insurance, everybody had some difficulty getting an appointment within 2 days. But that folks that were on Medicare or Medi-Cal had even more difficulty than others at getting that appointment within 2 days. But this highlights something that we already know is a concern in our county, that it can be very difficult to recruit providers to Monterey County, and actually even more difficult to recruit providers that it can accept Medi-Cal. But I'd like to let you know about a real bright spot that has occurred just recently in our county, and that our Medi-Cal managed care provider, recognizing this, and has developed a capacity grants program to provide recruitment reimbursement costs to bring providers to our county. So I'm thinking that this graph, the next time we're able to present it in a few years, we might really see some changes in that result. Now, health services alone account for, maybe about 20% of our health outcomes, or can be attributed to about 20% of our health outcomes. A much larger contribution to health outcomes is how the environment around you helps you make healthy choices, and that those healthy choices are possible for you. And we did further analysis of data and came up with another sub-priority for health, and that's that the built and natural environments are designed and cared for to support healthy living throughout the county. So this word cloud demonstrates why that sub-priority was developed. Now, you might be wondering what a word cloud is, and I can tell you that as a card-carrying data geek, that us data geeks have even created data in such a way that we can turn a picture is worth 1,000 words now, literally. And so what happens in a word cloud is that the frequency of the times that the word appears, and this was from the open-ended questions in the surveys, gives you the size of the word. So the larger the size of the word, the more often that word appeared in the open-ended questions. When we asked people, what they liked about Monterey County, and what they really like is the environment around us. And that environment is contributing to them being able to make healthy choices and have healthy lifestyles. So a really quick story about that is also, though, the fact that they recognize that not everyone has access to low-cost or no-cost amenities. And one community where this was really apparent was the story that was told where it was difficult for them to have access to a field because there was a fee to access that field. And so actually, for people who couldn't find that financially attainable to pay that fee, they would climb the fence or look for gaps in the fence to access that field for exercise. And then our youth even recognize what it takes to be healthy. They were asked about having access to free drinking water at the school, and some of them said, 21% said that they don't have access to free drinking water at the school. Well, we already know about that, and we know that the schools and the school districts are trying to address this, but there are a variety of circumstances as to that can contribute to the needs there. And this actually might be a great early win opportunity for us if we could find an investor to help the schools and the school districts to put hydration stations in some of the schools. But what I do really like is that the youth really know what it takes to be healthy, including drinking water.
Great, thank you, Krista. And that was a lot of information. You made it under the red card. It was perfect. So, thanks. I want to stop for a second and get us ready for the questions. Now, I'm hoping some people are writing down questions we're going to ask one more time. If you would put your hand up if you have questions. If not, I came prepared, and we spent a lot of time saying, okay, if nobody asks a question, what do we hope they ask us here? So there's one over here, Julie. There's some in the back if some folks would hand out their questions. Thanks. All right, Krista mentioned that when we talked about health, people regularly began discussing safety. So we've asked Alfred, if he would then take on the issue of safety.
Okay, I'm going to take a few minutes to talk about the community priority of people are safe. And I want to remind everyone that each sub-priority tells us what success will look like in the future. The survey results show that 60% of adults who took the survey reported that street or gang violence as their number one health concern. 58% of adults stated that a safe neighborhood influences whether or not they would exercise regularly. With that being said, only 11% of adults and 50% of youth respondents reported having been threatened or harmed by someone in the community in the last 12 months. While we all know violence is an issue in our community, the data reveal that the perception of violence or lack of safety needs to be addressed. During community conversations, people across the county expressed a real desire to get outside and to get to know their neighbors. But there was also fear about going outside. At Chispa, we've learned that the importance of creating opportunities for people to come together. Our mission at Chispa is to improve people's lives and create healthy neighborhoods. It's not really just about building buildings or units, it's about building safe communities. We design community centers within our apartment complexes. We have after-school programs and programs for adults. We partner with various nonprofit organizations from Monterey County, such as the YMCA, Boys and Girls Club, the Alisal Center for the Fine Arts, and Soul Treasures. We have arts programs, we have music programs, and for the adults, we have civic engagement programs as well as leadership programs. The other things that we look for is having our residents have activities outside their neighborhood, like going camping, going to field trips like to the Monterey Bay Aquarium. Basically, our community centers serve as a space where families, neighbors can come together, where they can develop trust with each other, where they can have conversations about their issues that they may have in their neighborhoods. It's really about creating a safe place for families to come together. That is why it is important to create the opportunities and spaces for people to be in relationship with each other. I'm going to take a moment to speak about the sub-priority of the community promoting peace and equity. As Krista mentioned, equity was elevated by the community through the process. Impact Monterey County made specific inquiry into how people were being treated based on a variety of factors shown on this slide. You can see that people felt that race and ethnicity was the most common reason they were treated unfairly in our community. This is one of the reasons you'll see a value around relationships based on respect, caring, and cultural sensitivity being advanced by Impact Monterey County. A recent example of the community coming together to promote peace and equity was Ciclovia, an event that took place, about 3-4 weeks ago. Ciclovia was organized by Building Healthy Communities, and more importantly, it was led by our youth. It was supported by the City of Salinas, by business and local organizations. It was an event that opened up the streets, the Alisal Street, to the public. People from all over the county came together, people of all ages, people of different ethnic backgrounds came together. We need to keep this at the top of our minds as we go ahead or go about our work if we're going to realize our community's priorities. And now I'm going to turn it back to Sharon.
What we're going to do now is I'll do a little bit of just a couple comments, and then we'll go into the questions section. Just to give us a little framework, when we first started with the Impact Monterey County and the steering committee, who led the design and the implementation. At the very first meeting, it was a clear message to the group that was working that we couldn't just do an assessment. This had to have some very clear action. We didn't want this plan to be put on the shelf. This is a big vision. I think it's Mary Gunn who's told me that it's a 50-year plan, folks. We are talking about changing things over the next 50 years. This is not for the faint of heart. This is for those of us who have courage. My guess is that although I may have some longevity in my family, I'm not going to see that 50-year plan, but I have a real willingness to say, as do many of you, and see these priorities changed and the things that we are concerned about and help our folks reach their aspirations. So it's not going to go on the shelf. It's going to be lived, and all of us, I hope, will get involved. So let's get to some of your questions. Yuri, do we have any questions for me here? And we'll address them. Okay. All right. Brett, you're a representative
Yes,
of you're a representative of business. What kept you coming back? What got you engaged in Impact Monterey County? What kept you coming back? And then how can business get it? How do you see business being involved?
So there's a couple parts to that. First, the why, besides the fact I got to see you and a whole bunch of other charged people every month. That was a positive. I'll tell you a little story. So I played football from when I was in the 3rd grade into college. My high school senior year, we had 3 people on our high school team who eventually got Division I football scholarships. Me at Berkeley, go Bears. One who became a tight end at UCLA and actually scored 2 touchdowns in the Rose Bowl, and one who was a starting defensive tackle for the University of Oklahoma. We won exactly 0 games my senior year. Okay? So what the why is, you can have a bunch of people who are very dedicated, as there are in this room, but everybody's got to be pulling the same direction. And we have to share aspirations, we have to support each other, we have to bring along those who aren't necessarily D1 players, like many in this room. And so what really excites me is teamwork and being able to focus our resources and our talents. And I think that's a way to achieve these aspirations. For the business community, my hope is that we can communicate this in an effective enough way. We have this incredible, generous business community in Monterey and in the Salinas Valley, and I want them to be so inculcated with these aspirations that these funders, when people go to ask them, they say, how does this assist in the community aspirations? What is this furthering in terms of our community aspirations and our collective goals for Monterey County?
Yeah, that will be the real test when our funders and our people we're asking to volunteer say, how does this all relate to those priorities that we're working on in our county? So good. Thank you, Brett. Our next question is for, I'm going to give it to you, Krista. The Health Department did an assessment in 2010, and how did those results relate to the work that's done here?
Well, the health assessment in 2010 was used actually for the data, the secondary data analysis. Some of it went into the Impact Monterey County report. Also, some of that data went into what's called a Community Health Improvement Plan, which actually highlighted areas of health priorities and indicators associated with it, and a variety of initiatives that were just starting and underway within the last 2 years. And many of those initiatives are all now meeting and talking about how they will carry forward aspects of Impact Monterey County, aligning their work and their indicators with these priority areas. And in particular, as it relates to data and having data available, not only will the Impact Monterey County data be available on the impactmontereycounty.org website, but also we're all talking about how we can create a data dashboard for all the indicators and track our outcomes together and how we're all contributing to improved outcomes in the county. So stay tuned for that.
This next question can just tag on to that. It's for you. What's special about getting an appointment in 2 days? I mean, why is that a key? Was that a key indicator? Could you just talk a little bit about that?
That's just a general standard that's used for the difficulty or the ease with which you can get a medical appointment. So 2 days is a standard that's asked in behavioral surveys across the nation. So that's why we use that one. And that just indicates that there's some openings, there's availability, and when you are trying to get an appointment, usually it's because you have an issue that you're wanting to see your physician about.
Great, thanks. I'm going to give this one to Cynthia. It's not directed to anyone, but what data surprised you most?
I think for me and for a number of people, it was learning how high the educational aspirations were for our juniors in high school. You know, oftentimes we think that our world was very different from theirs and that there's a generational gap, but I think we could be wrong. So that was very powerful. And then that together with the juxtaposed reality that they've got the high sights set very high, and yet they're not being prepared enough to be ready for college, and knowing the disappointment that must come with that. Those two things together, I think, were the most impactful. And I think another one was too, the way in which the self-sufficiency, economic self-sufficiency data was presented just in a basic budget. You know, we can all relate to that. You have your income, you have your biggest expenses, 3, 4, 5 things, and seeing that about half of our families, their income is about half of what the self-sufficiency level is. That's really painful to see. So those were the two things, I think, speaking for me and reflecting some of the conversations with other committee members.
Right. Okay, this next question is for you, Alfred. It has to do with affordable and accessible housing, which was talked about both in self-sufficiency and also for you. When people talk about how accessible housing, what do they mean by quality and accessibility? Can you just talk a little bit more? What is it that they're looking for? What does quality mean? What were we told in the accessibility?
Well, I think in terms of quality, I think we want housing that's safe and really healthy. In fact, that's something that is talked about very commonly now in the housing world, about creating healthy housing, that you have, in terms of designing the space, that you have the design such that you create spaces for people to come together, as well as making sure that you have proper lighting. You know, I mentioned how we have our community centers and residents come together, both adults and children. We've had our residents come to us and tell us, you know what, there's some places in our complex that are pretty dark and there's things going on that we don't like. So we meet with them and we ask them what are some suggestions, and we ask them to come up with suggestions, and we react quickly. And it's about making sure that we design that properly. Then in terms of accessibility, a few years back we had the opportunity to work with the Central Coast Center for Independent Living to really understand how do we make housing accessible so for people who have disabilities or seniors with age-related impairments. But also I think it means pricing. You know, that's a major issue in Monterey County. I've been working at CHISPA now for 23 years, and since the time that I started at CHISPA, 1992, wow, it's a long time ago, we've been one of the top 10 least affordable regions in the whole county. And I think that's the issue about accessibility. I think it's pricing, that the income levels here aren't high enough to support the current rents as well as the home prices, but also making sure you have proper design. You know, zero-step entries, for example. Do you have proper lighting? Just many issues. I mean, many factors that you have to look at. And we've learned over the years. We learned how to design things much better over the years.
Great, thank you. We have questions, and we aren't going to be able to get to them. I want to turn it back to Katie for her closing remarks. But they all will be up on the website. So we'll take your questions, they will be answered. So even later on, if you think of one, just write it down, give it to us, and we'll answer them on the website. So with that, thank you very much to our panelists. We appreciate that. Job well done, a lot of information. And Katie, back to you.
The nearly 7,400 people who participated in the impact assessment not only told us what we should work on to improve lives, but how we should go about doing the work The people of Monterey County want to live in a place where relationships based on respect, caring, cultural sensitivity, and fairness foster connectedness and community engagement. They want whole person approaches that include support for mind and body and that are available from prenatal through the senior years. They also want community voices to drive the design and implementation of services and policy development.
These values will serve as reference points for all of us when designing solutions, enacting policy, or implementing programs. We take this as a mandate from the people of Monterey County. It's what you told us that you would like to see, the kind of community you want to have. What will this get us? The vision, together a healthy, safe, thriving Monterey County. Our community, you all have given us a big vision to realize.
So there's already good work underway at the regional and local and neighborhood levels. There are initiatives currently underway working on education outcomes, safety, and violence prevention. The Impact Monterey County website continues to provide results, data, and more information about the priorities and work going forward. You can find that at impactmontereycounty.org. United Way will take a lead role in ensuring that the vision of Impact Monterey County and the community is realized. This is a 25+ year horizon for the work, and it's bigger than any one organization. Together we can make this the Monterey County that our people so want it to be. Thank you so much for taking the time to learn about Impact Monterey County, and please visit the website.